Hello, my name is Pravit from Bangkok, and I must say that I'm very excited to be in a personalized medicine era. Of course, we all know that psoriasis comes in so many different ways, and many of them would require special kinds of treatment, special kinds of biologic to tackle and to make them improve. Um, we are actually envious by many physicians in other fields because there are so many treatment options on the horizon. Biologics, among other promising molecules on the pipeline, we are now able to clear areas that we were not able to clear in the past, like the scalp, like the hands, even the nails. Some people have perfectly fine nails now and they can go to work without having to worry about them. But what I'd like to talk about today is a personalized medicine in a different context, in a more humanized or even more human way, and that deals with communication. Of course, I often ask myself, is there really valid severity score? We do need severity score. I don't argue with that. We do need them for, policy making, for running clinical trials. But when we see patients on a day-to-day basis, are we allowed to judge them whether they have moderate, severe, or mild psoriasis? The lady on the right has psoriasis only on the armpit, but that gives her smell, and it, you know, doesn't allow her to wear shorts, spaghetti shirts. So it could be severe for her. Is that a severe psoriasis? Even when we talk about quality of life questionnaires, everything is, standardized. You get a score of one, you get a score of three. But what does it mean? So when you treat a patient on a day-to-day basis, is it better to replace that with a look at the eyes and maybe one or two genuine questions that would help you pick the specific things that would affect a patient's life and quality of life? We all know that medicine is actually the interpersonal aspects of patient and physician relationship. It is a known fact that physicians are not great listeners. So, in short, listen more, talk less. But we're surprised, or actually not surprised, that most physicians would spend just a few seconds before they start interrupting the patients. So listen more and giving them appropriate, right amount of information. I think that's one of the keys. To me, it's not the what that is important, but it's the how. So that's why I put the how as a big, font versus the what. We always talk about comorbidities, and the list of comorbidities keep expanding. We now have uveitis, periodontitis, whatever you name it. We have maybe 40 or 50 comorbidities in psoriasis. But should we talk about that at the first visit or even second visit, or should we focus on a few and start, working on them? Which one is better? And I think people know that they have these comorbidities with them, but that's often, bad news to learn. So, and we call them modifiable healthcare behavior or health behavior. So one of the most important thing is dealing with weight issue, and I think that's very, very difficult. 10 or 20 years ago, I would have said Thai people are never fat or are overweight, but now I take my words back. So again, it's the how versus the what, and I think all people know that it's related to eating and exercising and everything else. But to make it simple, I usually use the acronym SEX: sleep, eating, and exercising. We're going to leave the exercising today because of the time. But I think, as I said before, losing weight and talking to them about eating habits is very important. Sometimes focus on one pizza. Just lose your pizza. Stop the sugary drinks. or save it for a special occasion. Don't make every day your special occasion, but save it for a birthday, an anniversary. That helps a lot. And I always say that people always start with exercising 5 days a week, 30 minutes until you cannot sing. But I always say the first step, the small stride, is the thing to go versus the full marathon. When you talk about full marathon, you end that day. You don't have future. But you first talk about, just moving, start walking, then you're getting somewhere. This is an example of people or a patient who could lose weight, 15 kg, and he responded much better to the same dose of methotrexate. But as we all know, losing weight is not as easy as gaining weight. So he gained back 24 kgs, and his psoriasis came back with a vengeance. Another thing that I find very useful is most people would start with conventional steps. Losing weight, exercising, the psoriasis will get better, but sometimes we have to reverse the sequence. This is a young man who have a new onset psoriasis, not too severe, but because he's young and he has to, meet friends and be in the society. So I started with biologics, just a couple of doses, and then used methotrexate. And finally, he was on nothing whatsoever for over a year or two now. And he started exercising and taking better care of himself, losing weight, stopped drinking alcohol. So I think reversing the sequence is one way to go. Again, if all else fails, bariatric surgery is not a foreign concept right now. And this is an example of a patient who was on irregular injections of ixekizumab. But there were certain plaques that I was not able to clear. But when she decided to embark on the balloon, the bariatric surgery, she was able to clear some of her psoriasis, just like that. Sleep, the first letter in sex is a big player. But again, I'm gonna leave you all to that. I think you have all the tricks and tips to relate to your patients on how to listen to, you know, a little bit of a boring story podcast and then fall asleep, keep the room dark or whatever. And I always allow patients normal lives because when they read on the internet, they would find that this should not be done, this food should not be taken, this is bad, this is bad, this is bad. So they cannot have any normal lives. So as long as it's not dangerous, such as, dangerous rolled pills in certain parts of the world, where you can end up having hepatitis, then I would allow them. But, dangerous things, I would not go with that. And then when they have drug holidays, we always talk about adherence. Of course, adherence, especially in terms of topicals, is a big, big, big issue. But most people would find it very difficult to be adherent to topical medications. So, drug holidays, I would take it as drug holidays. We all have cheat days, right? When we do keto, when we eat, very dangerous foods, junk foods. So people are allowed, they should be allowed to have some drug holidays, and I would not blame them. I would encourage them. Sometimes I would say, oh, because you're getting better, so you're not too worried. But if you want to get things better, then you might want to apply more. I think that's a more positive way to go. Treatments must be tailor made, and I think we all agree on that. Even small areas of involvement, for example, the nails. Some people don't have any plaques on the scalp or the body, only the nails are affected, but this is bad. So we need to concentrate on that, work hard on the nails, and then you get the patient. uh, a very young person who's going on being a conscript, you might work on a combination. This is a combination that would be frowned upon in the West, but here in Thailand we use it quite a bit. Combination of methotrexate and narrowband, and we could clear the patient quite quickly. On the back, and people often talk about having psoriasis for the lifetime. And I think when they start talking about having psoriasis for a lifetime, it sort of make them depressed. So I'd like to focus on now. At least in every patient, I think among the bad, there must be some good. Use the plaques that clear is my trick. So, you know, even when other plaques are still there, but there must be some plaques that responded to treatments. Use that plaque to at least reassure the patients that we're working, great together. Plaques on the scalp. My very final word should be a friend. And many times when you're friend with your patients, they do things for you, even though they're actually doing things for themselves. The psoriasis get better, and they would apply the medication for you. They would go for the recommendation made by you. So be a friend. And I thank you very much for your attention. In May of 2023, we're going to have a World Congress of Dermatology in Singapore, and I'm sure there are lots of sessions on psoriasis, and I'll see you there. Thank you very much.